Mackenzie's family?
Oh, that's me.
Hi, I'm her doctor. I just came out of surgery with her.
Hi, I'm Kenzie's mother.
She's doing just fine. I do want to go ahead and kind of take you into a side room and we can talk about everything.
Okay.
Is that okay?
Yeah.
Okay, well, it looks like she's doing fine. With the car wreck, it looks like it kind of ruptured an aneurysm. I don't know if you were aware of what that was. Okay, well, I did bring a pamphlet for you, kind of explaining kind of care and what an aneurysm is, but I'll explain it. An aneurysm is just a weakened wall in one of her arteries and it ruptured. So she kind of had a balloon sac inside one of her walls and it just ruptured because of the crash, the trauma that came from it. But luckily she came in and we got it repaired. We went in and did a Gore-Tex graft on her. So we opened her up and we put in a stent in there, just kind of making sure that the wall is going to be set in place and it'll kind of reinforce the wall, so it'll be structured.
Okay.
Okay? And we are going to watch for some complications that could happen because of surgery, just like any surgery. We're going to watch, monitor her vitals and all sorts of, and all the other good stuff with labs. But I'm going to talk to you about a couple specific ones.
Okay.
She could have a graft occlusion or a rupture, so it's pretty much the graft didn't take. It wasn't staying well. So with that, we're going to kind of look at her extremities because that would prevent blood flow down into her extremities. So we're going to look at her pulses in there, making sure that there is a pulse there. And we're going to look at the color of it, the temperature, and ask her if she has any pain because that'll kind of give us clues.
Show the blood flow?
Mm-hmm.
Okay.
It'll give us all those, her feet and everything. It'll kind of give us signs of if it's not taking. She could also have a hemorrhage, just like any kind of other surgery. You always have a risk for a hemorrhage, which is just bleeding.
Okay.
So we're gonna kind of watch that, look at her labs and vital signs with that one. It looks like she could also go and have a paralytic ileus, which is that her bowels aren't moving, and that's expected with any kind of surgery, especially with something like this. It'll last probably 2 to 3 days normally, and then we should start hearing regular bowel sounds. And we're going to monitor her labs and her urine output to make sure that they are working properly. And with her renal failure, she could have a possibility of a renal failure. Now that's her kidneys aren't going to be working right and failing.
Why?
Whenever we went in to her, we had to stop any kind of blood flow so that we could stop the bleeding, so she wasn't bleeding out. So we had to stop any kind of blood flow to her kidneys, which they should start working with soon, and they will be fine.
Okay.
We're just going to kind of watch labs and her urine output with that one.
Okay.
Okay? But yeah, they should be okay. We're just going to kind of watch that just like with any other kind of surgery. And there are a couple other ones. She could have paraplegia, which is she can't move her extremities. Now that would be more if the aneurysm was up higher. Probably won't, since she did have good blood flow to her spine from the location that was at. She could have cardiac arrhythmias, which is kind of her heart's beating too fast and not working properly. And since she has hypertension, we're just going to monitor, make sure that she's getting her meds right and everything. And then she could also, because of her past respiratory history, she could go into respiratory distress.
I told her to quit smoking.
Yes, that is a very important deal. But from the surgery, she could have lack of blood flow to the lungs. So we're just going to kind of keep listening to her lung sounds, and especially she's on a vent, which will help the oxygen.
Tube?
Yeah, that's a tube, and she should be doing fine on that. It's usually our patients are usually only have them for a day or two, so we'll just kind of monitor, making sure that her lungs are working right and everything. So right now she looks great. Surgery went really well. It looks like they're ready. If you want to go in and look at her.
I'd love to go see her.
Okay.
Thank you.